Okay. Hello, everyone. My name is Dr. Marty Kotler. I want to thank you for attending this webinar on prior authorizations, pre-certifications, and medical necessity review forms. Just a quick disclaimer before we get going. The information in this program is for educational purposes. It's not intended to be a substitute for your thorough clinical decision-making. It's not intended to substitute your billing protocols. It's not intended to be legal advice. Target coding does not provide legal services. CPT is a registered trademark of the AMA, and every attempt has been made to make certain that the information in this program is 100% accurate. However, it's not guaranteed. We have a lot of people listening to this webinar today. Some of you are past attendees of our webinars and seminars. Some of you are members of Target Coding, and some of you are brand new to my company. So for those of you that have no idea who I am, let me tell you a little bit about myself. I'm a chiropractor. I practiced for 16 years prior to starting my company, Target Coding. I am also a certified professional compliance officer and certified billing and coding specialist. My area of expertise is in coding, billing, cash practice compliance, documentation, durable medical equipment, risk management, record keeping, Medicare, and HIPAA. You know, I consider myself kind of unique. Let me tell you why. Most doctors are not certified coders. Most certified coders are not doctors. So you'll see during this program how I combine both specialties to help you improve productivity, maximize reimbursement, reduce administrative burden, and show you how to get paid for everything you do. Target Coding has been helping thousands of doctors and their staff members for over 15 years with our exceptional products and services. Okay. Now, Target Coding members, 24 hours after the webinar is completed, you have the opportunity to get the playback recording. You can get all the notes, the playback recording, plus all the PowerPoint slides. You can get the forms that I'm going to be showing you. Plus, you can get a certificate of attendance. These items will be waiting for you in about 24 to 48 hours after the program is over. Log into your account and you could watch this recording again. You can get all the notes and the forms. And you could also get a certificate of attendance. We recommend you place your certificate of attendance in your billing and coding policy manual. It's a good idea to do that. You know, if you've been to our seminars and webinars in the past, we stress the importance of having a billing and coding policy manual, a HIPAA policy manual. Use their certificate of attendance as proof that you take billing and coding seriously and you care about preventing fraud and abuse. Now, non-members of Target Coding, if you would like a certificate of attendance, no problem, we'll send it to you. Just send an email to info@targetcoding.com and we will email you a certificate of attendance. Any questions so far? Email info@targetcoding.com. All right, let's begin the program. Prior authorizations, pre-certifications, and medical necessity review forms. Now, there are pros and cons to being in-network, pros and cons to being out-of-network. Now, when it comes to filling out prior authorization forms, pre-authorization forms, pre-certification forms, medical necessity review forms, I kind of interchange those terms. These are required if you are in-network. You don't have to do any of this if you're out of network. Now, it's voluntary if you're out of network and you want to try and get your services pre-authorized. I'll show you how you do that. But if you are required to do prior authorizations and pre-certification forms and filling out medical necessity review forms, you are in network. You are contracted. You have a contracted with the plan. So now, very common question we get, especially from doctors that are new in practice. Should I go in network? Like my nephew, he's starting out in practice. He says, hey, Uncle Marty, should I go in network? Should I stay out of network? So I'm not going to tell you to join any plans. I'm not going to tell you to drop out of any plans. That's a business decision you'll have to make. There are definitely pros and cons to both. So let's go over them. So to begin with, credentialing and contracting. If you want to go in network, you will need to get contracted. Fee schedules are different. Deductibles are different in and out of network. Now, one of the most important parts or most important features of being in network is you'll probably get more new patients. Why do I say that? You get a phone call. Mrs. Smith calls your office and says, "Hey, I'd like to make an appointment. Are you in network with my plan?" If you say, "Sorry, we are not in network with your plan," there's a chance she won't come in. If you say, "Yes, we are in your plan," the patient will probably come in. So new patients are important. Now, there are some plans that my clients are in, which they don't particularly love the paperwork or the fees. However, you could use it as a loss leader. For example, you're in network with a plan, and let's say the plan gets you get paid for 6 visits, 8 visits, 10 visits. Fine. After 6 to 10 visits, the patient reaches maximum therapeutic benefit. Transition the patient to maintenance care, wellness care. That's cash. Those are cash-based services. By the way, this Thursday we have a cash-based webinar. It's called From Compliance to Cash. We're going to be going over all cash-based services. Now, some people call me the insurance guy. I'm not the insurance guy. You want to put a label on me? I'm the compliance guy. About 40% of the doctors that we work with are cash practices. So there's definitely things you need to be aware of when it comes to cash practice. But we're not talking about cash practices today. We're talking about pre-authorizations, filling out paperwork to get your visits approved. So as far as credentialing and contracting, if you're brand new in practice, you need to get an NPI number. If you want to see Medicare patients, you need to get a Medicare PTAN number. That's called the Provider Transaction Access Number. If you're in network, you probably want to go to CAQH, that's a secure central database, and fill out your information there. You want to go in network, you'll have to fill out managed care applications. By the way, we do credentialing. If you need help getting in network with any plan, Blue Cross Blue Shield, Aetna, Cigna, United Healthcare, Humana, Medicare, let us know. That's part of the services we offer now. We do credentialing. So here are some of the managed care plans, in-network plans, also known as third-party administrators. I interchange those terms. So OrthoNet is an example of a third-party administrator. They're the middle person between you and the insurance company. There's Whole Health Living. If you work with Humana patients, Simply Healthcare, you're probably familiar with Whole Health Living. Healthways, some Anthem Blue Cross Blue Shield plans work with AIM and Carelon. You've probably heard of Carelon if you practice in Ohio. Evacor Healthcare, CareSource works with AvMed, ChiroCare. If you're in Minnesota, you know what ChiroCare and Fulcrum Health is all about, and UCare and Health Partners and Medica. And here we have the two big ones, Optum, and American Specialty Health, ASH. So let's go over some of the most important forms that patients need to fill out. Brand new patients come into your practice, they're going to need to fill out forms. Now, if you have good quality software, you could send the patient an email after they make the appointment. Send the patient an email with a link to join your patient portal. Patient creates a username and password, and they could fill out all these forms online before they even come in. So you should have a good quality health history questionnaire. Make sure the patient fills out every section, every page. Now, if you are in network with ASH, American Specialty Health, they supply you with a whole bunch of forms. Log into ashlink.com. You'll see all their forms. This is their patient initial health status form. You could use this form, or you could use your own health history form. You should have a good quality HIPAA notice. Your HIPAA notice is very important because you have to disclose to patients that you're going to be sharing their information. Why are you going to need to share patients' information? You should know. To get paid. You're going to be sharing the patient's personal protected health information, known as PHI, with insurance companies, with attorneys, with collection agencies, with other healthcare providers. Informed consent. Now, this form has nothing to do with billing and coding. This relates to malpractice. Hopefully, you're never involved in a malpractice case, but if you are, this is the first form the attorneys are going to want to see. What did you tell the patients could happen from your treatments? This talks about the possible complications to chiropractic care. So what should you do? Check with your malpractice insurance company to make sure the form you're using is okay with them. There's also something called the no surprise law. The name says it all. For your cash patients, out-of-network patients, even if you're in-network, you're going to do something like laser or shockwave or decompression or PEMF. That's not covered by many plans. You're required to tell patients how much it's going to cost before you even provide the service. It's called a good faith estimate form, also known as a financial care plan form, and this relates to the federal government no surprise law. By the way, take a look at your financial care plans. Do you have your NPI number, tax ID number, and the diagnosis on it? You probably don't. How do I know that? Because I've reviewed thousands of financial care plan forms over the past 15 years. Those three items are typically missing. Now, some of you, especially staff members, may be saying, "Oh, time out, Dr. Kotler. I don't understand. Why do I need to have my NPI number, tax ID number, and the diagnosis on our financial care plans? I don't understand." And here's my response. I don't understand it either, but I don't make the rules. I just explain them and enforce them. The federal government wants those three items on your financial care plan forms. So let's talk about ASH. ASH is one of the largest networks. There are about 30,000 in-network doctors with ASH. If you're in network with ASH, hopefully you know what tier you're in. Tier 3, you get 5 visits, automatic. 4, 8 visits. Tier 5, 12 visits. We have a few clients that are in Tier 6, no paperwork, unlimited visits. If you're not sure what tier you're in, call 1-800-972-4226. Let me clarify this and let me give you a disclaimer. I don't work for ASH. I don't work for Optum. I don't work for any insurance companies. And no insurance companies work for target coding. So I just want to disclose that up front. So the information I'm sharing with you is based on my personal experience and my clients working with thousands of healthcare providers and their staff members. This is what I've learned over the years, a lot of information. So if you are in, regardless of what tier you're in, if you're treating a patient 12 years old or younger, you have to fill out a medical necessity review form, regardless of what tier you're in. If you're in network, take advantage of your in-network benefits. Go to ashlink.com, create a username and password, and now you could use this online portal. It's only for in-network doctors. You could submit forms, verify eligibility, get direct deposits, receive notifications. So the ASH in-network process, I have a little care plan. If you're in Tier 3, our experience is that we're getting our clients about 17 visits approved. So the first 5 are automatic. Those are pre-approved. So on visit 5 or 6, you'll need to have a conversation with the patient you see on your screen. Visit 5, patient discussion. So, Mrs. Smith, you have insurance. We're in network with your plan. Your plan requires us to fill out paperwork after 5 visits. So when you come in on your next visit, we're going to do a re-exam. Now, those of you brand new to ASH in-network process, you may be saying, Whoa, time out. We don't typically do re-exams on visit 6. Well, if you're in network tier 3 with ASH, you better do a re-exam on visit 5 or visit 6. If you don't, you're not going to get any additional visits approved. So Mrs. Smith comes back on visit 6 or visit 5, you do a re-exam. Now you're going to need to fill out medical necessity review paperwork. We typically request 12 more. Our average is 7 get approved. So on visit 7, Mrs. Smith comes in. Mrs. Smith, great news. We got you another 7 visits approved. Now, the 5 that they denied, you could appeal. We don't typically recommend appealing. Just take the 7. And now on visit 11, you have the conversation again. Mrs. Smith, you remember we told you you were covered for the first 5 visits? Then we got another 7 visits approved. Well, today's your 11th visit. Your next visit is visit 12. We're going to do another re-exam. Now, at this point, maybe the patient has reached maximum therapeutic benefit and they're ready to get transitioned to maintenance and wellness, and that's cash. Or maybe you want to request a few more visits. Our process and typical situation is we request another 8, and then we get 5 approved. So you total that up. That's how we got to 17. This is what the form looks like if you're filling it out on paper. It's the same process when you log into AshLink. So we have the process where the top of the form, basic information, the patient's name and the health plan and your information. And then we're going through the first 5 visits occurred. You'll see in this example, the patient came in on August 1st through August 15th and had 5 visits. There's our 5 visits. Now we want more visits. So we're going to request 30 days. Now, I know some of you may be requesting 60 days, 90 days. We have some clients, they're requesting 1 visit at a time. Go with whatever's working for you. If you're not sure what works, go with 30 days. In this example, August 16th through September 16th. Release date, September 16th. Re-exam is August 16th. And we're asking for 12 adjustments over this 30-day period, plus 2 therapies per visit. So you see on the screen the total, 12 adjustments, 24 therapies. Now the bottom third of this form, if you're filling this out on paper, I don't think there's enough room to build your case and get your visits approved. So you see on this form, this sample, it says, see attached. So you would attach something like this. Target coding members, you'll get a copy of this. Now, it might be a little small for those of you to see this. So what we're doing here on visit 6, we're providing an updated history, updated exam, updated diagnosis. It's like the before, you ever see at weight loss centers, the before and after photos? That's what you're doing here on visit 6. You're providing before and after. In this example, the before is on the first visit, lumbar flexion was 30 degrees. On visit 6, it's now 40 degrees. So we have a 20% improvement. So you're showing that range of motion is better. ADLs are improved. You're going to be using less CPT codes. You're going to revise your diagnosis codes. You're going to have updated goals, assessment, and care plan. And now you're going to ask, in this example, we're asking for 10 more visits. Now let's move on to Optum. Optum works very closely with United Healthcare. Optum in-network overview. You don't have to pay to join ASH or Optum. When you're new to the Optum network, you're put into Tier 2. Make sure you know which tiers you're in. So Tier 2 requires a utilization process. Utilization process because you're not using, well, you have not met a minimum patient volume, or you have clinical decision that's not aligned with current evidence and community standards. So that's Tier 2. Now, after you've met a minimum patient volume and you have clinical decision making consistent with Optum's, then you'll be placed in Tier 1. And what's your reward for going into Tier 1? There's a minimal utilization review process. Then, after 2 years as a Tier 1 provider, you get a reward. You get placed into a Tier 1 Advantage program. And then at that point, you don't have to fill out any PSFs, those patient summary forms. So if you're thinking about joining Optum, there's the link to start filling out your application. It would be nice if you can get your hands on the chiropractic plan summary through Optum. This gives a lot of really good information. It shows you a phone number to call, a fax number to submit information, where to mail your claims. Now, if you want to join Optum, you'll need to fill out their participating provider agreement. You'll have to have a certain amount of malpractice coverage. General questions for in-network for Optum, there's the number that I have for you, 1-800-873-4575. And here's the process. For Tier 2 and Tier 1, you're going to need to fill out the PSF, Patient Summary Form. Have you seen this? There's not a lot of room to fill out the information, in my opinion, in order to get your visits approved. The top third is patient information, their name, their address, and your information, your name and address. And then the middle section is where you check new patient, the diagnosis, and then the bottom third of this form, the patient fills out. So I don't see how there's enough space for you to provide your clinical data to build and support your case. So you'll have to attach your initial visit game plan, treatment plan. Now, United Healthcare has regular commercial insurance. United Healthcare also sells Medicare Advantage plan programs. That's also known as Medicare Part C. C is in chiropractic. So you should go to this website. This is the prior authorization process for outpatient therapy services for chiropractic and physical therapy. They have detailed information on it. I'm not going to get into this right now. There's the link right at the bottom of the slide. So you can go to this website and find out all the information for prior authorization for Medicare, United Healthcare, Medicare Advantage plans. Now, Blue Cross Blue Shield of Minnesota, as an example, has pre-authorization forms that need to get filled out. This is what it looks like. They all have pretty much the same questions. What's wrong with the patient? What's the diagnosis? What are the objective findings? How many visits do you want? Care Source in Ohio. This is for Ohio chiropractors. This is the provider prior authorization request form. Similar questions, diagnosis codes, exam findings. This is Care Source's Medicaid prior authorization form. Once you fill out a few, it gets easy. Maybe the first few you may think is a pain in the butt. They're not that hard. And as I mentioned earlier, for ASH, like some of the in-network providers say, I don't want to have to fill out all this paperwork. If you noticed, to get 17 visits approved for ASH, you have to fill out 2 forms. Let's say each form takes 30 minutes. So is it worth your while to get 17 visits approved for 1 hour of paperwork? I'll let you decide. This is Healthways, pre-authorization request for chiropractic manipulation services. Here again, once you fill out a few of these, they get easy. This is for Evacor, chiropractic treatment plan. You could probably even create macros. Do you know what a macro is? A macro is an automated shortcut that helps improve productivity. Create macros that you could click on a few buttons and you can just submit the information to these managed care plans. Oh yeah, as I mentioned, we do credentialing. Outsource your credentialing to us. If you're interested, you could scan that QR code to set up a free consultation with Natasha. Here are some of the ways to get more visits approved. Good diagnosis codes. Just subluxation and lower back pain and neck pain, you're not going to get more visits approved. Plain old spasm, these are short-term treatment diagnosis codes. You want to get more visits approved? Use long-term treatment diagnosis codes, assuming they're clinically applicable, of course, like sprain. Sprain relates to ligaments. There's lumbar sprain and cervical sprain and sacroiliac sprain. Now, those of you that have been to my seminars and webinars in the past, you know how I stress the importance of making sure the diagnosis code you use is provided in your notes. You need the clinical rationale for the diagnosis code you've come up with in your documentation. So here's one for sacroiliac sprain. Remember in chiropractic school, the gold standard tests for sacroiliac? What is it? Yeoman's, Gansland's, Faber-Patrick. Radiculopathy is a long-term treatment diagnosis. Here again, if you're submitting M54.12 cervical radiculopathy, just make sure your notes say, Mr. Taylor presents to the office with neck pain and pain, numbness, tingling, radiating down into his arm. And then have good orthopedic, neurological, and chiropractic tests to support it, like Jackson compression, Valsalva, Sperling, shoulder abduction, decreased range of motion, myotomal weakness, subluxation, hypomobility. Sciatica is a long-term treatment diagnosis. Don't use unspecified codes. With sciatica, with or without low back pain, it's either right side or left side. Don't use unspecified sciatica codes. Here again for sciatica, antalgic lean, Bectorou, straight leg raise, Kemp's, diminished sensation in the dermatome, herniated discs, bulge discs. Now, herniated and bulge are not in the ICD-10 guidelines. What are they called in the guidelines? Hopefully you know. They're called disc disorder and disc displacement. Now, here's a question we get at our help desk. Dr. Kotler, do we need an MRI to justify disc disorder, disc displacement? The answer is yes. So again, I'm taking off my compliance hat. I'm putting on my 16 years of chiropractic in the trenches treating patients hat. In order to diagnose a herniated disc, a bulge disc, you need an MRI. Especially if you're using disc disorder with myelopathy. You can't see myelopathy on X-ray or just from an exam. What is myelopathy? CAs? Myelopathy is spinal cord compression. How else can you get more visits approved? By reporting complicating factors. What's that all about? Quick example, patient number 1 has low back pain, that's it. Patient number 2 has low back pain and type 2 diabetes, which is causing lower extremity peripheral neuropathy. The peripheral neuropathy is causing the patient to have pins and needles tingling in the feet. What is that causing? That's causing the patient to have difficulty walking. What is the difficulty walking causing? The patient to have the main complaint of lower back pain. You see how that cycle goes? Report complicated. Here's a few on the screen. Report these, submit these complicating factors and comorbidities to your in-network plans. You'll get more visits approved. Some of you like external cause codes, especially for your PI patients. For example, V43.51, Just those 5 digits tells State Farm, Geico, Allstate, your patient was injured. Your patient was the driver of the car. Your patient was in a crash with an SUV. How about V03.10? That tells the insurance carrier, your patient was injured. Your patient was a pedestrian and was hit by a car, a van, or a pickup truck. I'll give you one more. W2.11. That tells the insurance company, your patient was injured. Your patient was the driver of the car and was injured by the airbag, the automobile driver side airbag. How do you get more visits approved? Here's the third way. These are pearls you should be incorporating. With OATS, that's the acronym for outcome assessment tools, like the neck index pain form, the Oswestry, the Roland Morris, upper extremity. Have the patient fill these out and submit them to your in-network plans. For example, Mrs. Anderson, can you put on your socks and shoes? And she circles the number 0, extreme difficulty. Mr. Johnson, can you lift a bag of groceries out of the trunk of your car? He circles 1, quite a bit of difficulty. Submit those. Let the in-network plans know about these restrictions and ADLs. There's so many of these great forms. Now, once you submit your information, you're going to get response forms. So this is an example of one that comes back from ASH. This doctor asked for 12 adjustments. Only 6 were approved. Asked for 12 therapies. All were denied. We get these at our help desk on a regular basis. What happened? The answers are right on page 2. It says, Doctor, the patient's pain level is mild. Doctor, orthopedic neurological tests are all negative. Doctor, you're using short-term diagnosis codes. That's why we didn't approve the visits. So the answers are right in the response form. So make sure you learn the rules. ASH has guidelines on manipulation, on home traction, on documentation. Optum has guidelines. Oftentimes with Optum, they'll tell you we're denying all 12 visits. We're going to approve 8, and it's based on guideline 47 or 49. Unfortunately, some doctors get audited by Optum. You send in your notes and they go, well, based on our guidelines number 49 or 47, 48, that's why we're not paying. So learn the rules. You have to learn the rules in order to know if you're following them. Now, I learned the rules. Oftentimes, when I do my live seminars on the breaks, chiropractic assistants and some doctors will ask me, how do you become certified in coding? How do you learn all this stuff? These are the guidelines I read on a regular basis on E&M. I'm already on 2026. 2026 diagnosis codes are out. E&M guidelines are out. I'm always reading the Medicare guidelines. Now, I know some of you are probably saying, I'd rather have root canal than read these guidelines. I know, we all have strengths and weaknesses. I don't find billing and coding boring. I love reading these guidelines. I'm a sponge for learning. I'm constantly referring to these guidelines from Aetna, Cigna, ASH, Optum. Do it on a regular basis. I constantly contact chiropractic state boards. Just yesterday, a client of ours wants to pass on the credit card surcharges. You know what I'm referring to. Instead of the provider billing, absorbing the 3 or 4% fee from the credit card companies, this chiropractor wants to pass on the credit card surcharge to the patient. Well, some states allow it, some don't. So I sent an email to the state board and they said, sure, you could pass it on to the patient. So constantly contacting state boards. Here at Malpractice Carriers, I read their newsletters and journals because we do seminars on risk management, malpractice prevention, and medical errors. So I want to know what's going on regarding malpractice. I get these OIG alerts sent to my emails from doctors that have committed insurance fraud. Look at this chiropractor's going to jail. Now, why do I read this stuff? I read this stuff because I want to know how to avoid these things, how to share with the entire chiropractic profession, how to prevent these problems from going on. Hopefully you get our e-newsletter. We send out an e-newsletter to over 20,000 offices nationwide, just about every month, and we share these horror stories. Look what's going on. Look at this podiatrist convicted of a $4 million foot bath fraud scheme, physical therapist, physician assistant, the owner of a medical billing company is going to jail. Here's a chiropractor from Louisiana who's going to jail for 7 years for insurance fraud. What did he do? So I learn from this stuff and then I share it with the entire chiropractic profession. Now, a couple of things about phases of care. Many doctors like to put the phase of care in the notes. For example, the patient's in the acute phase, subacute, therapeutic, corrective, relief, active, wellness, maintenance, rehabilitative, performance enhancing, supportive. In my opinion, it's a waste of time to put this in your notes because there's only 2 phases. Active therapeutic care, which means the patient has pain, restricted motion, inability to do normal activities of daily living. This type of care is typically covered by insurance because they consider it, quote unquote, medically necessary. The other phase is wellness or maintenance, where the patient has no pain, good range of motion, they can play pickleball, they can do all their normal activities of daily living, and this is considered not covered by insurance because they consider it, quote unquote, not medically necessary. So this is what you should be thinking, doctors and staff members. After every patient visit, after every man, woman, and child gets their chiropractic treatment, a decision has to be made. Was it active? Was it maintenance? And that's what the notes should reflect and your financial policy should reflect. Just don't get caught in the middle. That's where some doctors have to give money back to insurance companies because their notes look like it's maintenance, but they billed it as active. And it has nothing to do with frequency. Another common question we get at a help desk, Dr. Collar, if I'm treating a patient 1 time per month and submitting that to insurance, is that a red flag? Am I going to get audited? No, I don't think it matters. As a matter of fact, many of the doctors that I've worked with that have been audited, it's for patients that have been coming in 3 times per week. So financial report of findings, patient education, very important. Have written financial policies. Target coding members, you know what I'm referring to. You all have my financial policy. Gets patients to understand they are responsible to pay. It prevents doctor upsets. Doctors, this is my goal for you. When you look out into the waiting room, you see a patient and you're thinking of their condition. There's Sally sciatica. There's Carla, she has knee bursitis. There's Lauren, she has a herniated disc. Staff members, billing department, this is what I want you to see. Oh, there's Sally. Her back brace got denied. There's Norman, we need an ABN sign. There's Laura, Cigna's waiting for the notes. There's Nancy, we need to get an updated credit card. There's Robert, Blue Cross Blue Shield is waiting for our notes. Doctors, that's your viewpoint. Staff members, your goal, if you're in the billing department, is to get the doctor paid for every minute he or she is with the patient. So this is the out-of-network financial form that we give. This is Target Coding's insurance non-covered services form. Now, keep your fees simple. Fee confusion is one of the most common causes of complaints to state boards. We're working with 5 doctors right now. 4 out of 5, the state board got a complaint from the patient because of fees. One example, the patient wasn't told how much the doctor was going to be billing their insurance. The patient didn't like the doctor's amount he was billing the insurance. Another one, the patient wanted her money back. The doctor didn't want to give the patient her money back. Patient filed a complaint with the board. All patients should be aware of your normal fees if you're giving discounts. If not, it can cause sticker shock. All right, we're rounding third, heading home. Just a few closing comments. To begin with, prevention is the key. Don't wait for the oil light to flash on your dashboard. Next, have policies and procedures regarding billing and coding and documentation. Have a policy on documentation. One part of this policy is that you document within 24 to 48 hours of the patient encounter. You can't wait 3 weeks or 3 months. So have a policy on documentation. If you don't have good documentation and you are required to send in your notes, you may get a letter back like this. This chiropractor billing Cigna had to send in notes. Cigna reviewed the notes and said, we don't like your notes. We want money back. You see how much? $250,000. Oh, here's another one. We're working with this doctor. This is actually good news and bad news. Doctor was billing Blue Cross Blue Shield. Blue Cross Blue Shield said, we want to see your notes. Doctor sent in the notes. Blue Cross Blue Shield said, the good news is we don't want money back. The bad news is we're putting you on a prepayment audit. So if you're familiar with that, you know how that can cause chaos. Now we're working with one doctor. We worked with this doctor, very busy practice. She sees about 80 patients a day. We helped her with her intake forms, patient forms, care plans. She had to send in her notes. She wasn't thrilled about it, but she felt pretty comfortable based on our training. So she sends in her notes, and this is the letter she gets back. It says, dear doctor, based on the documentation reviewed, we found that all services were reasonable and necessary. It says, we applaud you on your billing accuracy. Wait, what? We applaud you on your billing accuracy, and we encourage you to continue your current billing practices. This is a great letter. If anybody has a letter like this from an insurance company, please send it to me. I'd love to see it. So have policies on discounts, on prepaid plans. Have a policy on how you train your employees on billing and coding. If you don't have one and you have the time to do it on your own, go for it. If you don't have the time, let us help you. We'll put together a billing and coding policy manual for you. It doesn't take that long and it doesn't cost that much. I recommend this book. This is a book that I wrote on the best codes to improve reimbursement. It shows you the long-term treatment diagnosis codes, like sciatica. It's broken down by anatomic site. There's a whole list of them right there on the screen. We show you how to pair you should be, a lot of people like to pair food and wine. You should pair your CPT codes and your diagnosis codes. Your CPT codes are what you're doing. Your diagnosis codes are why you're doing what you're doing, and they should pair. There's an example. If you're doing myofascial release 97140, that pairs beautifully with myofascial pain syndrome M79.12. Traction pairs beautifully with radiculopathy. So yes, this book should be part of every chiropractic billing and coding library, in my opinion. It helps prevent denials. It has the best PI cheat sheets in the industry. The doctors that buy this book, many of them take a page out of the book and they use it as the topic of the day when they're doing their billing and coding trainings. We do webinars. live webinars and on-demand webinars, go to targetcoding.com, click on the on-demand tab. You'll see we have over 25 on-demand webinars ready to go. Many of them are approved for CEUs in many states. So this is our library of on-demand classes. They range from risk management, Medicare, ICD-10, cash-based services like neuropathy, shockwave, laser. We offer CA boot camps. We call it our CATS program, Chiropractic Assistant Training Series. Perfect for brand new CAs. Even CAs that have been around for a while, seasoned CAs benefit from this too. Example, class number 1, we go over spinal anatomy, chiropractic terminology, how to onboard a new patient. In class number 2, we show CAs how to fill out a 1500 form. There are 33 boxes on the 1500 form. We go through every single box and we show you how to analyze EOBs. In class number 3, we show CAs the Medicare guidelines, the ABN forms. In class number 4, we show CAs how to help the doctor do the notes. Class number 5, we show CAs diagnosis coding, modifiers, rehab procedures, exercises, unit reporting. And in class number 6, we show CAs HIPAA compliance and the 7 elements of an effective billing and coding compliance plan. All the forms, all the target coding forms you saw me show in this webinar come from this package of forms. Let us know if you're interested. We also offer a course on how to become a concierge chiropractor, how to appeal repricing of out-of-network claims. If you're out of network, you may have gotten a letter from MultiPlan or Data Eyesight. Interested in learning about that? Send an email to info@targetcoding.com. We do seminars in hotels. We also do seminars on cruise ships. We have our next cruise seminar coming up later this year on Royal Caribbean's Symphony of the Seas. I'm going to be teaching 6 hours, 6 CEUs approved in over 35 states. We're going to the Bahamas. We're going to St. Martin. We're going to St. Thomas. We leave out of Miami. This is going to be our 3rd annual CE cruise. You can go snorkeling, scuba diving, or you could do nothing. You could sit by the pool all day and drink margaritas. We have a lot of fun. I think the cabins are sold out pretty much, so check with our travel agent to see if you could still get in, but last I heard, the reduced fee cabins are already gone. We have tons of testimonials across the country. We offer memberships, 4 levels. Level 1 as low as $99 per month. We have options to fit every practice. Cash practice, Medicare, PI, in-network, out-of-network. Please check with all the carriers you bill prior to submitting claims to ensure that it's compliant. Target coding cannot guarantee that this information will guarantee payment from any insurance company or patient. Target coding is not responsible for any laws or rules that may change following this presentation. And you know they change all the time. So it's important to do your best to stay on top of these changes by attending seminars and webinars. Join your national and state professional associations. Again, prevention is the key. Now, follow us on Facebook, Instagram, LinkedIn, YouTube. I have over 100 free videos on YouTube. Stay in touch with us. Here's my contact information. Email info@targetcoding.com, website targetcoding.com, telephone number 1-800-270-7044. Yes, we still have doctors that like to fax us information. So we have a HIPAA secure fax number, 1-844-831-2347. If you'd like to set up a free practice analysis, we normally charge $350 for it. Would you like to do that? Just scan the QR code you see in the bottom right corner of your screen. Or you can give us a call, or you could send us an email if you'd like to do that. So again, I want to thank everyone for attending. I hope you learned a lot. Take care, everyone. Bye-bye.